Hello and welcome to the Airflow Health Breastfeeding and Health Equity Disparities Innovative Strategies for Health Plan Providers webinar. Really excited about today's webinar. We've got a fantastic panel and even better conversation set up for you guys today. We're really thrilled to have all of you participating in our webinar. If you'd like to jump into the chat and tell us what you do and where you're from, that would be great. And we want to make this interactive as we'll get into some housekeeping in a minute. So if you have questions and answers for us, you can put in the Q&A section, and we'll be happy to get to those by the end of the webinar. So let's get started. So before we begin, just a few things. The goal of Aeroflow Advantage being the Flow webinar series is really to communicate best practices to health plans and their employees, and to talk about topics which are really relevant and really related to overcoming disparities in healthcare, focusing on access, ensuring that people who have needs, whether it's for breast pumps or PAP devices or lots of other areas that Aeroflow Health focuses on, that we talk about those key areas and best practices so that they're closer and better, more effective partnerships between durable medical equipment companies and the health plans. That's really the goal. We tend to talk about that about a lot of different topics. Most recently, we talked about issues of maternal mental health and the challenges in managing that, and some exciting work that Aeroflow Health has been doing with Florida Blue and Canopy and its partners to really improve the health of pregnant people in Florida and address disparities in care at the same time. That will come up a little bit later in our conversation. And if you have questions, please submit them in the Q&A part of our Zoom conferencing system. And again, we'll save time at the end. We have a bunch of things to talk about first, and we're going to dive into those in just a minute. So let me introduce our panelists. We're going to give a quick overview in the interest of time. So we have Latisse Lee, who is a lactation consultant and educator at Aeroflow Breast Pumps. Hi, Latisse. So glad you could join us. She's really expert and works every day as a certified lactation consultant with our clients to make sure that they get the help that they need to be successful in breastfeeding their babies. Leah Walker, also with us from Airflow Breast Pumps. She's a lactation manager. Hi there, welcome. And birth team captain. She's also a doula in addition to being a lactation consultant. And we'll talk a bit more as we get into this about what that means and how it's related. And then Kara Walsh is a managed care associate at Aeroflow Health. Kara, welcome. Glad to have you here with us today. And Michelle Haggerty. Dr. Haggerty is a board certified integrative family physician. She specializes in breastfeeding and lactation medicine and is also a perinatal mental health specialist and knows a lot about the challenges that expectant moms and new moms face from a behavioral health perspective. And we'll get into that as we go through the session today as well. We also have with us Ryan Bullock, the Chief Strategy Officer from Aeroflow Health. Ryan, glad to have you here too. Really expert in all things Aeroflow and durable medical equipment and the policy impacts in terms of how patients are able to access these services and supplies when they're needed. So Ryan will help us think through sort of what's changing, what's evolving in this space, and we'll get into some really interesting conversation related to that as well. So let's jump into it. Again, we're here to talk about health equity and disparities and how health plans can adopt strategies to really overcome some of the barriers and reduce disparities in access to breastfeeding support. I would be remiss if I didn't mention that August is Breastfeeding Awareness Month. So I hope everyone already knows that. You're already celebrating and sharing messages about this. We're thrilled to have you here as part of Aeroflow's celebration recognition of this important time of the year. So let's jump on in. Ryan, I'm going to ask you actually to tell us a bit about Aeroflow and explain what these numbers mean.
Absolutely. And thank you for the introduction, Mike. Airflow Health, and specifically what we're talking about today, is Airflow breast pumps. And with that, we wanted to kind of share the reach that we have with this segment that we service and have the privilege to participate in servicing. And so with that, we reach 40% of all U.S. births in the country, and those patients are seeking some type of service or support for breastfeeding through Airflow breast pumps. And with that, we've serviced actively over the past year over 1 million patients, where 200,000 parents have received some sort of lactation service from us, with 70% of our patients continuing to engage with us up to 1 year postpartum. The next measure there is 85% of insurance covered lives Aeroflow Health is in network with. And so our solution allows us to have that broader reach. And then finally, 87% of the patients that we service experience high ease of use and self-accessing our solution without having to engage one of our personalized concierge service navigators. So really, hopefully it sets the stage of the reach and the number of patients that we service and the impact that we have in the space.
Great, thank you. And I think it also points out that you know a lot about what's going on with health plan coverage for breast pumps and for lactation consulting and for breastfeeding supplies and all the rest of it. And I think in my work with Aeroflow, it's been helpful to share that perspective and to be able to act as sort of an advisor and offering best practices to our clients and prospective clients, of course, from the health plan side. So really looking forward to hearing more about Aeroflow and what we're learning, what we're seeing, and the trends that we're observing in this area. Unfortunately, despite the fact that there is health plan coverage for breast pumps and lactation consulting in some cases, there is variability in the way that new moms access actually how many of them initiate breastfeeding and are able to sustain it. So what you see on this slide is sort of breastfeeding initiation rates, and this is from the publication Clinical Lactation, which basically shows that in 2020, about 85%, 84% overall actually were able to initiate breastfeeding, which is pretty good, but that there's variability, and that variability is based on race. And so what you see is for Asian Americans, a little over 90% initiated breastfeeding. For Hispanic Americans, 87%. For white Americans, 85.5%. So already a 5% gap, that's a lot of babies, right? That's really what this is about, is providing the best possible nutrition for newborns and for toddlers up to age 2, according to the American Academy of Pediatrics, or at least age 1, as many people try to get to. So we're seeing a difference from the start. And for Black Americans, 73%, which is significantly below all of the other groups. So this is a serious challenge for us. And it's also difficult for these folks to access help from people who look like them, who come from their communities, and to be able, that's one of the big barriers I think that we have to access. Luckily, on our panel, we actually have true experts who do this work all the time. Latice and Aaliyah, maybe Latice first. Can you share with us what you do when working with health plan members? Like, what does lactation consultant actually do?
Yeah, so as a lactation consultant, we're there to sometimes clarify breastfeeding goals with moms, to give them that education and that support that they need. We know with breastfeeding, like support is one of the biggest indicators of success and preparedness. So we try and give them a head step for that, and also let them know that we're there to support them afterwards as well. So full spectrum, prenatal and after babies here in terms of support for them.
And do you do group sessions or one-on-one, or how does that work?
Both. We offer group sessions where they can learn in education classes with other people and ask questions and further clarify their knowledge on certain topics. So again, they feel prepared. And then one-on-one, we get really individualized and tailor plans of care for them, birth plans, et cetera.
Great, great. And Leah, maybe you can tell us a little bit more about what a doula does and how that's the same or different than lactation consulting.
Yeah, absolutely. So kind of just going to the definition of a doula, right? It's a non-medical person who has been trained to assist other families during childbirth, and who may also provide support to those families after the baby is born. Now, where it differs from lactation support is that not all doulas will have additional lactation specific education and training. For the doula certification, many doulas will have to take maybe like one breastfeeding class just to kind of get a basic knowledge, but they may not have those additional tools in their bag to be able to help these families be successful at initiating and the duration with being successful with breastfeeding as well too.
Great. And how does this work? Usually I think of a doula like being in the birthing suite with the mom when delivery is occurring. But now we're seeing sort of the advent of remote models using video and telehealth and telephone. Does that still work? And how does that work?
Yeah, absolutely. I mean, especially with having the pandemic, a lot of families were turning to getting that extra support because they were having limited support in the birthing space, right? And so having that virtual doula can definitely be helpful. We can also help guide the support person on things that they can do hands-on, maybe doing some double hip squeezes in the birthing space, how to massage them, how to understand some of the information that they're receiving from the medical providers as they come in and kind of update them on the progress of labor. We're kind of there to help support understanding that, right? Because sometimes you don't know when you're not a medical professional. So it's definitely been very helpful to help those families throughout this time, even virtually, and even afterwards, helping them postpartum as well.
Fantastic.
Mhm.
One of the challenges, I think, in terms of access is because there's variability in the way that different health plans provide coverage for doula services, for lactation support. Kara, you're our managed care expert. What is the difference between what a commercial plan will cover or a state Medicaid program will cover? Just curious to know more about how different kinds of plans cover these benefits.
Yeah, we're seeing a lot of differing coverage as far as like the policies, like you said, for doula and lactation. I think in addition to what Aaliyah said, Aeroflow really stands out as far as we allow more of that prenatal education. So that way mom and dad or parents go into their birth feeling prepared when you're speaking to doula services. We're seeing that we are having to provide a lot of education to these health plans to really differentiate a doula versus a lactation consultant. Again, a lot of there's a misunderstanding that a doula does provide the same care with lactation versus a lactation consultant. So a lot of education to the health plans and stakeholders of the differing provider types. With commercial plans, we're seeing a lot more coverage with doula services and with lactation, which is wonderful. And we're seeing a lot of Medicaid state plans really break into that space as well. So we'll talk about that a little bit later, but we are seeing a lot of these policies really kind of come to terms with the day and age with allowing telehealth, which is wonderful as well. So we are seeing a lot more positive change in this space.
Fantastic. Leah, I'm curious, on the doula side, there is increasing evidence, isn't there, of the effect of doulas in terms of avoiding some of the challenges that we know that, for example, Black women have much higher mortality rate, maternal mortality rate, that their babies have a higher infant mortality rate. So do doulas impact that? And is that why we're seeing the employers pay for this and health plans expand coverage?
Yeah, absolutely, for sure. When it comes to doulas, of course, we kind of studies show that doulas have a 25% opportunity for you to, not request maternal interventions, the medication, pain relief, and things like that. And not that those things are bad. The problem is that in some situations, you have kind of what we call a cascading effect, right? So when one intervention happens, then another intervention happens, and so on. And so some of those things can have an impact on the outcome, not only of breastfeeding, but just the outcome of the birth and, how things go with the baby as well, too. So it definitely is helpful to have doula support there to be able to provide these families with the opportunity and just the ability to be able to kind of move through this space in a way that is going to be the most effective for them, the safest for them, but also providing them with the opportunity to avoid some of those interventions that can cause disruptions.
Got it. And as someone, I don't know if it's common for doulas to be certified lactation consultants or for certified lactation consultants to be doulas, but
Not
someone
at
who's like
all.
both, how do you, figure out in that moment, is it more of a breastfeeding forward discussion or is it something else? Like, are you just thinking I can do whatever the patient needs? I'm just going to do an assessment and figure out how to go from there. Like, what's your approach to ensuring that they're getting everything they need?
Yeah, a lot of times because I kind of wear both hats, of course, you have to kind of swap one out for the other every so often. And I think it does really kind of go to listening to your patients, listening to them, understanding what their needs are, and then kind of determining what the goals are from there, and then discerning whether this is a breastfeeding issue or is this something that I need to support more in my doula space, right? So I think it's just really about listening to the patient and providing that extra support as they need it.
Great. And Leticia, I'm wondering, as someone who's not a doula, do you refer to the doulas? Do the doulas referring to you? How does it work when you're not the integrated doula lactation consultant?
So I worked as a registered nurse and in a postpartum unit in the hospital previously to getting my IBCLC and did that there for a little bit. And the doula support that you see in the hospital makes a big difference on the outcomes of the parents, like in the labor space and in the postpartum space, because they seem more informed, they seem more educated, they seem more prepared, and they know their resources that they have available for them. So they're not operating out of fear, they're operating out of informed decision-making. So definitely see the difference in how they have more of a voice.
Got it. And for women of color or mothers of color, does it matter that there is a doula who looks like them, comes from their community? Does that have even more impact? Does it help to reduce the disparities in terms of maternal outcomes and also in the successful healthier births?
It does. It does because it creates a safe space where the person feels heard. Sometimes, with implicit bias, a lot of times it's very unconscious. So it's not like someone's intending to not listen to the patient, but it could be a bias that happens without them being aware of it. So with that being said, having a provider that knows this person, or a doula, right, that knows this person, knows their needs, understands what's normal, what's not normal for them and for this particular population, it does really help for them to feel heard and to be able to advocate for things that they notice that may not be going in the right direction.
Got it. So the more folks we have who can access doulas, who can access lactation consultants, the better. And that again focuses on more of the birth process and breastfeeding. But there's another big component of this, and that is behavioral health, mental health. And Canopy is one of the partners with Aeroflow. Michelle is someone who works with moms and babies as a physician and also works with Canopy. What do you see as sort of the opportunities for health plans to support better access to mental health services? I mean, are the benefits currently structured so that all of the people who need it can access mental health services, or is there room for improvement?
Yeah, no, there's definitely room for improvement. So, I around lactation and around the mental health space for sure, for both. So my private practice, fourth trimester doc, I focus on caring for dyads as a whole. So we see birthing people and their newborns, and serve as a unit, right? And it's really important that we sort of identify the fact that the health of the infant is sort of reliant on the health of the birthing person, but then the vice versa, the health of the birthing person is reliant on the health of the infant, really. So they go so hand in hand. And yes, definitely around the mental health space, we need to be. I don't necessarily see that health plans are really providing the same level of coverage. A lot of people have cost sharing requirements, so they have to be paying out of pocket for their care, or they have trouble finding care providers that are versed in perinatal mental health, and so it's definitely a barrier to care for folks, for sure.
And do you see a correlation or causative effect where if you provide more mental health support, more breastfeeding success is more likely? I mean, what's the relationship between access to mental health services and successful breastfeeding?
Yeah, absolutely. So really mental health is critical for breastfeeding or body feeding success, especially when challenges arise. We see that lactation challenges and perinatal mental health and anxiety disorders are really just sort of go hand in hand. When we have someone who has challenges with lactation, it's almost inevitable that they will also have challenges with their mental health, and vice versa. So if they're having challenges with their mental health, also it's not infrequent that we'll see challenges with lactation as well. For example, I actually use it for diagnosing or actually deciding whether I need to address something even further. So an example of this is like if somebody who has a huge freezer stash of breast milk that they're just storing that breast milk away, and I'm like, it's an indicator for me that there might be postpartum anxiety involved, and so it's a way that I can sort of access that for folks. And that vice versa, if I'm seeing somebody that is coming to me for perinatal mental health challenges, I always ask about lactation because inevitably there'll be something going on with that as well. So yes, hand in hand, really, really critical to be addressing both.
Because breastfeeding is not always easy, right? So if you're not doing it well,
Never. Yeah.
right,
Yeah.
and then the more anxious you are, the harder it is. We've all been in that situation, right, where we feel incompetent about something, and then the more incompetent we feel, the more incompetent we are. It's like this horrible. Are you able to break that cycle? Are you able to provide interventions which help get the breastfeeding back on track or help deal with the anxiety, which then allows the breastfeeding to come back on track? Like,
Yeah,
what are you
absolutely.
actually doing to help people?
Well, addressing both at the same time, right? So it's addressing whatever the lactation concerns are. Are they having recurrent mastitis? Are they having issues with overproduction? Why are they storing all this breast milk? Are they worried that they won't be able to feed their baby for some reason? Or is there, sort of they're having scary thoughts or intrusive thoughts that are kind of coming up. They're making them be very, very anxious. So then when they bring the baby to the breast, or having that lactating relationship, they're very anxious as the baby's coming there. So it can be all hand in hand. There's so many things that can be addressed that even if you're addressing something on one side, it can sort of help the other side as well, just as sort of a downward effect. But then it's helpful to address both at the same time. So absolutely. And we need to be asking those questions more, right? So there's people that are, seeing people specifically for lactation, but are they asking about the mental health side? Are they asking and getting people referred for support with that? Or people being referred and seen by people who are undermining the lactation side, for example, like they're seeing somebody for perinatal mental health and they're saying, well, you just need to stop breastfeeding because that's going to help, because now you're going to be able to sleep, and then that's going to be, the benefit for you. And that's not necessarily going to be that helpful. So really addressing both is really what and goals and priorities for people is really important.
It takes a village, and not
Yes.
helpful.
Mm-hmm.
Village is not supportive of breastfeeding. So glad that we have advocates for both. Can you say a word, Ashley? I know you work with Canopy. Can you tell us a little bit about who's Canopy and how people access it?
Yeah, so Canopy is a really great resource. It is a maternal mental health app that provides evidence-based and compassion-based therapies to help expecting new birthing parents understand and cope with the turbulence of motherhood or parenthood. And no matter where they are coming from. So if they're, if they're pregnant or if they're postpartum or where they're at in their journey, we're sort of there to be able to support that. The core program is 12-chapter set of audio and video sessions that are quick and provide practical lessons. And then there's also a slew of expert-led virtual classes, which is part of what I'm involved in, that really supports sort of that community building and learning with direct access to those experts in real time. And then finally, there's also open hours for postpartum folks who have specific questions that pertain to their individual sort of unique needs and circumstances. And the really cool thing is that they found clinically significant improvement in 80% of the population that they've served. So there's a lot of benefit for utilizing this program.
Wonderful. And we have an exciting announcement for people who are interested in accessing Canopy. We'll get to before the end about being able to try it out as our gift. So we'll come back to that a little later on in the webinar. Ryan, I know recently Aeroflow collaborated very closely with Canopy and with Blue Cross Blue Shield of Florida, also known as Florida Blue, to better provide access to mental health services through Canopy, but also just better coordination and collaboration with a focus on reducing disparities in care and challenges to access for people of color. Can you explain a bit more about that and what we've learned?
Yeah, thank you for that, Mike. It has been a really interesting journey to go along with Canopy in partnership with Florida Blue. I think we've seen the evolution of this breastfeeding benefit that originally came about as a part of the Affordable Care Act, and that benefit has slowly begun to change over the years. And I think we're really starting to see the stride of elements coming together. A lot of what Dr. Haggerty just mentioned is the link and connection between breastfeeding and mental health. And so, the breast pump was one of the first things that was covered with health plans. Then we went to breast pumps and supplies and the importance of ongoing having clean parts and supplies to continue breastfeeding. Then the introduction of lactation consulting, doulas, as Aaliyah had mentioned, and all of the outcomes that are weaved in by having that introduced into the process. And I think now we're seeing the opportunity to interweave mental health into that as well. And for us, I think it was really interesting in the Florida Blue pilot, and we're continuing the next phase of that as well, is that we have such a broad reach, and we're accessing those members. We get them to engage with Airflow, and then taking them a step further and getting them to engage with Canopy, and trying to meet the patient where they want to be met, when they want to be met, when that need is there and is important and present. And I think that's some of the things that we found out through this pilot. We also have been able to help Florida Blue really focus on those patients that have identified as a medium or high risk and need that additional help and support. And so Florida Blue has been able to deploy their case management team to better focus on those members that have presented with a need, while continue monitoring and supporting those other patients that are fortunate enough to navigate this process successfully.
Excellent. And great to hear positive outcomes leading to the next step, which is expansion, I think, of that program to other moms in Florida Blue. So excellent news. One of the things I did want to mention, in addition, and it kind of came up, is this issue of access to care. What's nice about Canopy is one of the nice things is that it's virtual. One of the nice things about doula services and lactation consulting now is you don't have to be in person. We know that 4% of babies are born in maternal care deserts. Only 21% of IBCLCs identified as non-white, even though we know that in healthcare in general, and in this area specifically, that people relate better and have better outcomes when they're working with folks who look and sound like them. And what's interesting too is the classes seem to work. 97% of moms who attended Aeroflow's classes felt more confident in their breastfeeding journey. And I think on average, they attended 3 classes. So it isn't like they do a one and done. They're able to come back and ask questions. Plus, there are the online resources I know that Aeroflow provides, just like Canopy does, so that busy people can access it at their convenience and can ask questions at their convenience instead of having to always show up for a certain class at a certain time. Let me begin by asking Latice and Aaliyah, what is a maternity care desert, and why does that matter? And why does it matter that there are only 21% of IBCLCs are identified as non-white? What's your experience with those two realities and how it affects your work day to day?
Great question. So as far as what a maternity care desert is, it was like a March of Dimes. They released a report on like maternity care deserts across the US. And it's basically where there's like a lack of maternity care resources, like hospitals, birth centers, where they get that support that they need throughout their perinatal period. So it is definitely a cause for concern if they don't have that access, in terms of having providers like people of color that look like some of the patients that have less access, right? It's important because, like you mentioned earlier, Dr. Cantor, they want to see themselves in their healthcare providers. Wow. Cultural humility is a big agenda right now, right? It's also helpful to have that culturally congruent care where they feel like their provider, again, is a safe space for them to share their thoughts, their worries, their concerns. They're going to get the support that they need that's specific to them. So it's definitely important to try and increase the diversity, at least in this profession.
Excellent. Anything you'd like to add in terms of, do you have examples of any of your patients who you work with or clients that you felt like you could make a difference because you had that ability to reach out to them in a different way, in a more direct way?
Yeah, I mean, I think one of the things that we love to have is after our classes and our consultations, specifically with Aeroflow, right? We have these links that patients can complete, and we get that immediate, right? We get that immediate feedback. It's so nice to be able to like scroll through the survey and read some of these things that people have to say. I highlighted one that I saw from Latice, actually, so I'm gonna brag on her for just a quick little second, if that's okay with Latice. There was a comment that said, the Aeroflow classes have taught me a wide range of information that I did not get from taking classes with my first birth. Latice consistently had great information to share with the classes she was a part of, and was very knowledgeable about birth and breastfeeding. And I plan to work with her again if and when I schedule another appointment. So these moms are getting the help that they need. They're very much coming back for seconds and thirds, and they want this help and support because they can't sometimes get it in these maternal care deserts, right? Sometimes these people that we're seeing are in little cities that we've never even heard of. I'm like, where do you live? Where are you from? And they have one hospital and, one lactation consultant or no lactation consultants. And so being able to provide that virtual space for these families is so helpful. It's so helpful. I mean, they really need it and they deserve it.
Excellent. Congratulations, Latisse. Really good to hear the kudos. Ryan, let me ask you, as sort of the policy person, telehealth obviously is critical to making this work, but it's not always covered for lactation consulting or doula services. The health plans, I think, are adjusting policies, Medicaid programs. What are your thoughts on sort of how we're going to be able to ensure coverage and access through telehealth? Because clearly access, especially in these small towns that Leah just mentioned, can be really challenging.
Yeah, I think Aeroflow Health would like to be a resource to health plans as we work in many of the states, and we're seeing some states that have legislation that's passed to overcome the credentialing and licensing requirements associated with doulas and lactation consultants. Some states have taken more of a policy regulatory approach in working with either the state Medicaid office or Department of Health and Human Service within their state to develop boards or subcommittees that can help navigate that. And so I think we're a resource in kind of having that environmental scan across the country with what we're beginning to see take place. I think that's the first thing. And then the second thing, to answer your question more specific with telehealth, is as we've all witnessed and been a part of through the public health emergency and COVID-19, is that telehealth was brought to the forefront and probably brought forward much faster than we would have if that event had not taken place. And we have seen an immense benefit for the patients that we serve. Just as Aaliyah had mentioned, I think we're able to reach patients that weren't traditionally able to be connected with previously, or be able to afford to go find the care and service that they need from another city that's an hour plus away from where they're currently living. And so I think telehealth can play a role in being able to help continue to connect to members. And Airflow, as I mentioned, wants to be a resource to try to connect some of those dots.
And is that happening? I mean, are the policymakers continuing to support, like you see on the Medicare side, which obviously not applicable to maternal health, where there's a lot of debate over how to cover telehealth and how many visits and what rates and all of that. Are you seeing the same thing in maternal health, or is there sort of agreement this is a good thing and we just need to keep doing what we're doing?
I think more broadly, there's an agreement. I think it is trying to navigate through those parts and pieces, as you mentioned. But I think overall, I'm not seeing much pushback on that. I think it's just taking the time to develop that and ensure that lactation consultants and doulas are included in that coverage.
Great. And we already talked a little bit about COVID-19 and its impact. One of the other big areas of the law or regulation emerged after the passage of the Affordable Care Act, which did provide, I think you mentioned earlier, Ryan, that was sort of the starting point. Kira, maybe you can help us understand a little bit more about, under the Affordable Care Act, what is covered, what's required, what's nice to have, and how does it impact specifically these areas of breastfeeding and breastfeeding support through lactation consulting, and also through doulas. What's happening?
Yeah, so as Ryan mentioned, breast pumps covered under the Affordable Care Act was really kind of the door to open that coverage, and then it went into supplies and now into lactation. Really, the Affordable Care Act, what that does is it allows and it mandates commercial health plans to really cover these services without cost sharing to the members. It's really meant to be a floor for policy, not a ceiling. So what we are seeing is, some of these health plans really are, mandating great policies with their coverage and covering doulas and lactation consultants. And unfortunately, we are seeing some policies that still just really use the ACA as kind of that ceiling and not much more. As you can see with the numbers here, telehealth is really the way to go. There's nothing in the ACA that mandates telehealth coverage, but we are seeing that so many barriers are able to be avoided, whether it's, work and childcare constraints, whether it's geographic of these moms located in maternal care deserts. So again, we're seeing a lot more health plans make the preventative approach to really expand beyond the ACA, which is great. So we are seeing a lot more of the state Medicaid plans beginning to implement policies. Obviously, we're seeing a lot more of the commercial plans go above and beyond the Affordable Care Act, which is wonderful, and really differentiate between the doula services and the lactation consultant services. Again, as I said, a lot of it comes back to education and really differentiating the differences between the two provider types and, identifying the scope of practice between the two provider types. And really the implementation of telehealth is becoming much more widespread, which again, with 97% of moms saying they feel more confident, is a wonderful stat. And what's really great about Aeroflow is we provide that preventative education. So again, it's, not reaching mom in a state of crisis, as Michelle mentioned, but really getting to mom, hopefully when she's still pregnant, providing that education, hopefully via telehealth, and really kind of setting her up for success when she moves into, labor and postpartum as well.
Great. And it's both the group coverage and individual coverage, because I think there's still in some places where you have to have the lactation consulting done by right after the baby is born and only in certain settings by certain people. So I think helping before the whole birth process is really, really important. Is that still an issue for some people? Like, does the coverage not allow them to access the group meetings?
It is. I think, again, it comes down to how health plans are really, reading the ACA and fully digesting that. Again, it states that breastfeeding is mandated to be covered throughout the duration of breastfeeding, which, as you mentioned, is now up to age 2 or beyond. And there really is no, identification of what provider type should be providing that. So a lot of times we are seeing that either the benefit is included in the global maternity benefit when mom is in the hospital and not prenatally, or we're seeing that it must be provided by an OBGYN, for example, which I'm sure Aaliyah and Latisse would attest to. An OBGYN is a great provider, but they are not the specialist in lactation. So again, Aeroflow does a lot of advocating for these providers and for, providers like Aaliyah and Latisse to really shine the light on what their specialty does. So again, OBGYNs are great, midwives are great, but they're not the specialist in doula and lactation. So again, the ACA does not really lay out what provider type should be providing this, but if you really want to provide the best benefit for the members, it really needs to be done with the specialized care.
Got it. I wonder also on the mental health side, if it's similar, like are practical steps being taken, like merge together the screening that's done for behavioral health issues and for social determinants of health issues together. Dr. Haggerty, what are your thoughts on that? Are you seeing now sort of a more comprehensive approach in the recognition of the importance of mental health, or is it still someone has to think about it, which means it may or may not happen?
Yeah, I think it's more the latter. Unfortunately, I think the coverage is sort of all over the place, and people finding access. I mean, well, it's very similar to sort of a lactation issue where people will maybe call their insurance company and say, hey, I need a lactation consultant, whereas one nearby, and then they'll give somebody that only sees people in the hospital, for example, or only sees somebody who is established with the pediatric clinic, which is different than their own pediatric clinic. Those are things that happen with lactation all the time. And it's very similar with mental health. Like, oh, these are the people that are covered, under your mental health benefits, but they're not specialized or have any training in perinatal mental health, which is a whole separate training. And so it's very frustrating for people because they're trying to reach out and trying to get access to the coverage, but then, they can't find it, or they can't have access to it, or they're not covered. So they'll have to go out of network, for example. And it's also very challenging on the other aspect for the perinatal mental health practitioners as well. So like getting licensed or getting credentialed with insurance companies as an individual practitioner is very, very challenging. You have to go for months, even up to 12 months before you even get paid for some of your services sometimes. And so, to do that as an individual is very, very hard. And as an individual practitioner. So a lot of people don't then go and get credentialed with insurance companies because it's much easier and more affordable for them to run a business, to be able to work outside the system. So there's so many barriers happening from both directions that make it very challenging for people to have access and for people to provide the care that people deserve to have. And then the other side of it, it's similar to lactation, is that we get a limited number of visits, for example, for coverage, or they'll only cover, percentages, and there'd be cost sharing as well. So again, it's out of pocket cost for people or they'll go toward their high deductible, and it just makes it financially really unsustainable for them to be able to continue to access the care they need.
And the ultimate result of that is lower breastfeeding rates of initiation and long-term success, which means babies who are less healthy It also means that their parents are less healthy because sick babies cause sick parents who have to take time off of work to deal with a sick kid, and then now they have to take time off of work because they're sick. So there's a
Exactly.
lot of
That
that.
it's the whole interconnection. It's that you can't separate one part of the diet from the other. They are so interconnected. They have to be treated together.
Got it. And Ryan, I'm curious. We've heard a couple of things, and just what Dr. Haggerty was saying. The health plan networks are challenging as they don't include all the people who should be included. Benefit designs in some cases are challenging, mostly not in terms of coverage of lactation consulting, but potentially for doula coverage or behavioral health coverage. What's your sense in terms of how companies like Aeroflow that provide lactation consulting, access to breast pumps and breast pump supplies, like what's the best way for health plans to partner to be able to take on a reasonable approach to this? And I think, by the way, from a financial perspective, it's pretty clear the return on investment for all these interventions is really good, even leaving aside the positive impact on challenges related to equity and disparities in care. We know, for example, there's like a 3-to-1 return on investment for every dollar you spend on lactation consulting and breastfeeding support in terms of reduction in costs to the employers and in healthcare costs. Ryan, what's your sense about the best way for partnerships to grow and to move forward?
I think for Aeroflow, and this is something that we're trying to do and break the mold with health plans. Maybe going back real quick, we mentioned the Florida Blue pilot with Canopy and Aeroflow. One of the things that Canopy is doing and providing is whole person care and screening for social needs. And so I mentioned that because I think it's an opportunity for health plans to work with suppliers such as Aeroflow, who is able to create access to members, get those members to engage. We're getting them to engage with the products and services that we offer. But what is that opportunity to further engage that member to activate on something that's meaningful to the health plan? And I think there's an opportunity for us to maybe think a little outside of the fee-for-service model that a lot of providers and suppliers kind of typically fall within, to see if there's an opportunity to tap into that chain of custody, if you will. I guess I think of mentioning chain of custody. I think of trust in healthcare, and I think we all think about believing in creating trust in healthcare. And in a sense, by creating that access and Aeroflow Health reaching those members, we're engaging them to do something. And so we're planning some deposits of trust. We have a great lactation service where we're continuing to create those deposits and trust with that healthcare member. I truly think that we can create and extend that chain of custody to go even further, to expand the trust in healthcare, and ultimately be able to help the patients that we're all here to serve, and working with health plans to navigate and figure out what some of those things might look like. One of the things that comes to mind is pregnancy notification, and trying to, health plans want to obtain that information as early as possible in the pregnancy. And that could just be one thing that I know health plans is currently looking to obtain that could be an opportunity for us to work together on.
Great. Well, thank you so much for that. Just review a couple more things, just in terms of what we've covered so far today. If anyone does have questions, feel free to pop them into the Q&A section of the Zoom software. You'll see at the bottom of your screen. Just to remind people and to recap. So we've talked about how breastfeeding and lactation consulting services are different than doula services, although they're both very complementary, and ideally pregnant people have access to both, and new moms do too. There are limitations in terms of supporting diversity and access to care, related challenges with accessing telehealth support for services, contracting with diverse providers, and building out a robust network more generally, and making sure that there's both group classes and individual access, because obviously in a class, you can ask some things and need some things in individual sessions. You can really get into the details in a much more helpful way. So that's really important to think about as well. And that overall, this works. mean, that's the best news of all, right? We actually have a problem for which there are solutions, where we have evidence that they actually work. And I think we're starting to see, because of that evidence, we're starting to see improvement. We're starting to see a trend it wasn't started last year or even a couple years before that, but since the passage of the ACA, and now 12 years ago, we're seeing slow and gradual, and as the evidence has come in, more rapidly increasing improvement in these areas. I just want to turn it over to the panel now, and maybe we'll start with you, Aaliyah. Given all of these changes and the challenges, what's giving you hope for the future, and what's worrying you that we might not get to where we need to go?
I think the thing that's given me the hope the most is that we are making leaps and bounds on, getting more access to these insurance companies that are allowing for more of this access to care and support. And part of the challenge that I feel like I have, especially with as a person of color, is that we just need to find more avenues to get more of these people credentialed to be able to help more of these people, because that ultimately, right, when we see these numbers and these rates across the board and how there's such a big like shortfall, right, shortcoming of these rates amongst the different ethnicities, I really hope I'm really hopeful that, we really can up that, right? Like up the ante on that. And I think that's why Letice and I work so hard to do the things that we do and advocate so much and attend these like webinars and things like that to kind of help, show that it's possible and that we're out there and it can be done, just to boost more of that morality for it. But I'm hopeful that we're going to continue to make strides to make good efforts and go in the right direction.
Great. Letice, do you want to add to that? What gives you hope, and what's keeping you awake at night?
What gives me hope is that there's still people out there who need help. They never go away. So if the hope goes away, then the help goes away. So in my mind is like, you have to keep pushing through for these people. It's not about you, it's about the bigger goal. We see the maternal health rates in our country, right? We see how people have suffered. And now we also see on the other side the big differences that we're making. We see a lot of equity scholarships to help make more people have an easier access to getting the education to be support providers for people. We see opportunities like this where they get more access through telehealth. So we can see the baby steps, right? And there's always hope for those steps to get a little bit bigger. So just keeping the hope ourselves, right, kind of helps us keep pushing towards that goal and knowing that we are making a big difference. We see it in our surveys. We see it from our feedback. We see it face to face when we're talking to people. And that's motivation enough.
Fantastic. Michelle, what are your thoughts about hope for the future, concerns?
Yeah, I think hope for me is, working with these various companies that are just being so innovative and sort of addressing these, in addition to what everyone else has said as well, but just really, connecting and coming together and finding solutions, as a whole, just trying to figure out how do we best meet people where they're at, really is what gives me hope. Personally, from what keeps me up at night is that I really want to move toward an insurance model or coverage that provides holistic dyad care. I just think it's siloing out patients separately from each other. It just doesn't make sense and doesn't work. So, it would include lactation and mental health and physical recovery and newborn care, all interconnected as sort of a whole model that, a whole like global model that's covered by insurance that really addresses the fact that people need support during this transition time, and is not just like these individual things that people need to meet their deductible for and have cost coverage or cost sharing for and need to use all these different services for. Like, let's do it as a whole and provide that coverage as a whole unit. So and that's really bringing that together everyone in under one space that really addresses that. So that's what's keeping me up at night, but I think we're moving in that direction. I have faith.
Yeah, I think that, and I think you encapsulated it well, and I think Ryan was talking about this before as well. It's the continuum of care, right? The recognition that the pregnancy journey is it's a journey, it's a process, and you need help along the way. And to have to go to 14 different places to get that help just isn't going to work. It's not working. It never has worked. If you look at the rest of our healthcare system, it's the same set of issues with lack of continuity, lack of consistent support, lack of access. And whenever there's a gap, the people who are more affected by that gap tend to be people of color, people from lower socioeconomic strata, which is why we have some of the reasons why we have the disparities we have today. And so by addressing that lack of continuity, not only make it better for patients and for people and their babies, but all of us are better because it helps everyone to do better and to have not just successful maternity journeys, but beyond that as well. Kira, what are your thoughts? What do you hope for, and what are you concerned about?
Well, all of the above, I definitely agree. And what's really great, I mean, Aeroflow is really meant to be that partner, right? For that continuity of care. You know, we're here to provide that from, you know, the moment you find out you're pregnant all the way through postpartum. And we've definitely made some strides from this time last year. You know, we're partnering with Virginia Medicaid, Georgia Medicaid, Tennessee Medicaid. So the coverage of lactation services specifically, as well as doula services, are definitely expanding from, again, what we've seen last year. We really are seeing these health plans, you know, really truly view the Affordable Care Act as the floor and not the ceiling, as I mentioned before. You know, we're seeing them expand, you know, when we were talking about maximum benefits and limiting number of classes, we're seeing them truly, you know, align their policies with the Affordable Care Act to be that, you know, continuation throughout the duration of breastfeeding. Meaning, if, you know, parents want to attend classes prenatally and then all the way into postpartum until their child is 2 years old, you know, you can't limit that to 3 or 6 visits. That truly is not the duration of breastfeeding without cost sharing, because at some point that is going to tap into their deductible or involve copays if they meet that maximum benefit. So we are seeing a lot of health plans really, truly, you know, again, correlate their policies along with the true meaning of the Affordable Care Act. And again, that's the duration of breastfeeding without cost sharing. So it's really great to see these policies expanding into the Medicaid space, as well as just further flourish in the commercial space. You know, we're seeing a lot more coverage with the group classes. Health plans and stakeholders are really, you know, seeing the true benefit, as well as the telehealth. You know, that is the big piece of meeting parents where they are. You know, they have work, they have children to, you know, put in care. And it just, we want to really just be that partner to lift that barrier. So it's really great to see that. You know, we're finding studies that show that telehealth is as effective, if not more effective, than in-person care. And so we just really want to be that partner to continue that.
Wonderful. Ryan, your thoughts?
I don't think I can add much more to what everyone has offered. Aside from you know, maybe there's an opportunity for us to send out to the attendees the Women's Preventative Service Initiative coding guidelines and telehealth guidelines that they've put out as kind of a roadmap to developing those policies. Yeah.
I'm just curious though, do health plans have a role in advocating for expansion of sort of state and federal policies? So if the ACA is the floor, is there an opportunity to advocate for the ACA if it is ever updated, or for the regulators now who are interpreting the ACA at HHS, for them to say, oh yeah, we actually think now preventive services include classes as well as individual. They include telehealth access as well as in-person access. Is there an opportunity for that at the state level, federal level, both? Just curious to hear your thoughts on that.
Yeah, I think obviously the ACA, there can be some contention around that, but what we see is health plans actually expanding their coverage beyond what the state Medicaid, for example, may be providing, and going above and beyond to include lactation services as a value add benefit to their members. And I think we're seeing that pick up a little bit, and I think that will just continue to inform policymakers, either on the regulatory or legislative side, to take a second look at what they currently have developed, and is there further opportunity to expand and beefing up that coverage.
Yeah, I think we're learning more is better, right? That's the general theme.
Yeah.
Here. So whether it's lactation, consulting support, breastfeeding, and breast pumps and supplies, doula services, behavioral health, creating that continuum that really helps people with different needs along the journey, I think is what we need to do. And it's really encouraging to hear that we're actually making strides in that direction. So our time is coming to a close, unfortunately. Let me just actually, Michelle, do you want to talk a bit about this? we're making available to people who want access to it to have a chance to actually access the Canopy app. Can you say a bit more about how this works?
Yeah, so I believe there'll be a link in, we'll put a link in the chat as well, but basically you can sign up and get the Canopy app for free. It's a $48 value, and using the access code health24. And yeah, and just like it's all the resources that I mentioned earlier, you'll have access to. So those classes, the program, the experts, connections, the open hours, all that stuff you'll have access to. So
Fantastic. Well, thanks
great
to
opportunity.
Canopy, thanks to Aeroflow for supporting our webinar and our participants who are interested in this. I encourage anyone who needs this to sign up because it is great. Questions that we've already been through, and just a few things on closing. So we will be sending out the link so you can watch this on demand, share it with your friends and colleagues who may be interested in this. Great discussion, really appreciate the insights from our panel and look forward to sharing that as broadly as we possibly can. Also consider subscribing to the newsletter from Aeroflow Health that has lots of helpful information like what we've been discussing today in it for you. Take a survey, please, at the end of the webinar. We're always trying to get feedback to figure out what we can do better next time. And then, of course, you can stay up to date on upcoming webinars. Our next one is going to be in a few weeks. And Aeroflow Health and social media, any social channel will have this. Our next webinar, by the way, is going to be to celebrate Sleep Awareness Month, which is in September, aka Sleep-tember. And we'll be talking about, interestingly, women's issues and challenges in sleep. So it turns out, surprise, surprise, that women have different expression of sleep-related issues, including sleep apnea, than men do, and that our system, again, surprise, surprise, isn't always so great at understanding those differences, addressing those differences. And so we're going to have some experts with us to share sort of the latest, best insights into this, not only what the differences are, but what we can do, just like we talked about today, to actually make things better and to improve access to necessary care. So that should be great. Look for details coming out on social media channels very soon. And most importantly of all, thanks to all of you. I want to thank our panelists who are great. Thank each of you for your insights and contributions. It's been fun to lead the discussion. And thanks to everyone who's joining us, whether live or in the future. Really appreciate the opportunity to bring these important issues to your attention. And if you have further questions, you can follow up with Aeroflow through social media at any time. So thanks, everybody, and look forward to seeing you again soon. Take care. Bye-bye.